Hello everyone, this is Dr. Schilling from Secoya Health here in Woodbury, and I want to share with you 5 secrets today about peripheral neuropathy you may have never heard before. First and foremost, number one secret is it's not a local issue in the absence of trauma. So unless you've been smacked on your hand, ankle, wrist, or other part of your body, it's not a local issue. It's first and foremost a circulatory issue, which means you're not getting the nutrients and the oxygen and the vitamins from your bloodstream down to that area. That can also be related to how your brain is interpreting the information, because you have the sensory and post-sensory parts of your brain that interpret the signals from your body that have to make sense of it, whether it's burning, tingling, numbness, feel like you're walking on eggshells, or bubble wrap or stuff like that we've heard before. It can be a lymphatic tissue, like if you've had chemo before, you're not getting the toxins out of your body. That can change how your nerves function. And if you're not nurturing your body, if you're not putting the right fuel in, then you're going to have some nutrient deficiencies. Okay, so that's number one. Number two is going to be not all neuropathies are the same. They're not all created equal. So you need a personalized approach to your neuropathy in order to get the right results that you're looking for. So that can be autoimmune disease. You could have surgery. You could have tumors. As we mentioned a second ago, chemotherapy. Medications can cause neuropathy. You could have, we mentioned before, trauma. There are vitamin deficiencies and even alcoholism. And in the rare cases, some people have tumors that can cause neuropathy as well. So that's secret number two. Not all neuropathies are the same. Secret number three, nerves can regenerate. A lot of medical doctors will tell you that nerves cannot regenerate. Once they're damaged, they're gone. I have one participant who had a neuropathy in her thigh for 25 years. We worked on her brain, and then the sensation came back in her thigh as just one of many examples. Jenny was astonished after 25 years that she had sensation back in her thigh. She thought it was gone forever. So even Harvard School of Medicine and Massachusetts General have performed studies to determine low-level laser therapy works, neurotropic or neurotrophic nutrition, like injecting nutrients into your body. Exercise can help. Managing your blood sugar is very helpful as far as managing and helping your nerves regenerate, because diabetes can cause circulatory issues as far as that goes. You've seen people with diabetic ulcers in their feet, having their feet amputated and things like that. You want to make sure you're having clean, healthy blood, you're well hydrated and things like that. And using high-dose vitamin B, B12 specifically, helps nurture the sheath over the neurons that helps them conduct signal. So number three is that nerves can indeed regenerate, and so you should not lose faith. Your body, given the right conditions, can heal anything, just about anything. Okay, so secret number four, medications do not, I repeat, do not cure neuropathy. Whether you're looking at Cymbalta, Neurontin, which is gabapentin, or whatever medication you might be told is going to help you cure your neuropathy, there are no cures as far as medications go, because they mask the symptoms. So you could continue to use your body and create pain and continue to damage the nerves by having, basically tape over the check engine light, which is your neuropathy, your symptoms coming back to your brain, if you will. They're going to provide some temporary relief in most cases, not all cases. And then, as we mentioned a second ago, they can accelerate your nerve damage by you not being able to feel what's going on in your body, just like when you do cortisone shots on joints. You don't know what's happening because your brain loses touch. It loses the inflammatory cycle and the feedback mechanism. So medications do not cure neuropathy. And most importantly, neuropathy is fixable. So secret number 5 is neuropathy is fixable. And how do we go about doing that? First of all, nurturing the body, giving it the hydration it needs, making sure that it has the nutrients it needs from a vitamin standpoint. We can use regenerative medicine. That can include stem cells or amniotic fluids, depending on what you need. We've mentioned vitamin injections are helpful. We can use PEMF, so these paddles over here, those are PEMF paddles, and that's connected to a unit which puts the earth energy into your body, which then ignites the cells and creates the activation of your energy centers in your cells called mitochondria. We also have a tool back here called Synexus, RST Synexus, which it's FDA approved for pain, but one of the most common symptoms with neuropathy is pain. We use vitamin injections when needed, and then we can use platelet-rich plasma, where we draw your blood out and get more blood cells, the platelet-rich plasma, back into the areas which have the quote-unquote neuropathy. We guide you on lifestyle changes, how to nurture your body, giving you the best food, the best fuel, helping you find strategies to swap out things that you love, even though they're taxing to your body, causing you stress. So Let's just recap. 5 secrets to peripheral neuropathy that you've never heard before. Number 1 is it's not a local issue. It's a circulatory issue first and foremost, and the nerves become damaged as a result in the absence of a blunt trauma to that area. Number 2 is that not all neuropathies are the same. Neuropathies come in different flavors, whether it be medications or diabetes and traumas and tumors and stuff like that. Number 3, that nerves can regenerate rather. They regenerate about 1 inch per month is generally speaking the estimated amount of speed at which nerves regenerate. Secret number 4 is that medications do not cure neuropathy. And number 5 is that neuropathy indeed is fixable and it does not have to plague you for the rest of your life. So if you or someone you love needs help with neuropathy, please contact us as soon as possible because you're suffering unnecessarily. We'll need to determine whether it's small fiber or large fiber and what other issues you have, whether autoimmune disease or diabetes and things like that that are causing some problems for you. But there are guaranteed ways we can help you optimize your health so you can live your best life. So give us a call today, click the button below or call the number below, and we'll be able to get in touch with you real soon and help you get to feeling your best and living your best life. All right, take good care.